So when you talk about running a Title V program in a progressive state that does this well, in Minnesota in those years, what are the elements that cause you to say, this was run well, this state did it well? What aspects of MCH were done well there?
That's a really good question. Part of it was just the overall culture of that agency. It had a leader at the time, and probably even before then, because you couldn't create this quickly, but the leadership was very strong. And the leadership recognized that the agency needed to be staffed with high-level, highly skilled professionals. And you might say, well, aren't all agencies staffed with highly skilled professionals? Not always, because these are often very political. Some of the leadership positions, a couple layers down in the organization, may go to people who are owed a favor for political reasons. Or state agencies, depending on where they are, where the state capital is, sometimes it's hard to hire people with a particular skill set, but you need to fill the job, so you'll fill them. This particular health department, located in the Twin Cities, actually on the Minneapolis side of the river. If you know the Twin Cities, the capital's over in St. Paul, but we were actually on the campus of the university near the health schools, which was tremendous because we were right near the medical school, right near the School of Public Health, School of Nursing, within blocks. So we had ready access to students. Students had access to us. There was a lot of back and forth, a lot of research going on, a lot of you could get to the experts. And not that you can in others, but the fact that you're right there and you run into each other in the parking lot or going out for a walk or getting Vietnamese food for lunch down the road just created a different kind of an environment. And then you have this really strong leader at the top who built this incredible cadre of highly professionalized, highly skilled staff. And we were a small agency. We were actually much smaller than a lot of other state agencies. So, the lean and mean kind of concept. So when I went from being the Children with Special Needs Director, I was promoted to be the Division Director of all of MCH, which was all the Title V programs and WIC at the time. It was later expanded, and I inherited a lot more programs. But at the time, the MCH part was pretty traditional MCH. So we had the family planning programs, we had WIC, school health, all the programs you would think of. But we had just an incredibly dedicated staff. And many of these people were one-person programs. So the person in charge of reproductive health for the entire state of Minnesota, there was one person. One person ran all of child health. One person ran. So you say, well, okay, that's not even funny. That's like laughable. But the state of Minnesota, in its infinite wisdom, some years prior, had come up with a system where they created a mechanism for the local governmental entities to relate to the state in a way that, almost like the way I described the federal-state partnership for MCH, in a way that let the local entities have the autonomy and the flexibility to do what made sense within their communities. So the state became, I hate to use the word pass-through because that makes it sound like it was passive, but it wasn't. So the monies that would come from the federal governments, whether it's the preventive services block grant at the time or cancer screening programs or the MCH programs, the WIC program, plus whatever the state chose to put in to health would come from the state health department to these community health service agencies, they were called. And the legislation that created them, you had to have a certain population size to be a community health service agency. So in some of the more rural areas, multiple counties would come together to achieve that population mass. So you were working with a group that was of a size sufficient to get work done, and you worked with them in a partnership. We provided data, we provided technical assistance, we advocated for certain things, but at the end of the day, they were making local decisions for their local communities.